True or false? The flexors of the wrist originate on the medial epicondyle. True. True or false? The medial nerve courses down the posterior aspect of the forearm and supplies all muscles that extend the wrist. False. True or false? Pronation and supination occur at the forearm, wrist, and hand. False. A muscle that contracts by pulling the distal and proximal attachments closer together is defined as a blank contraction. A muscle that contracts by pulling the distal and proximal attachments closer together is defined as a concentric contraction. True or false? Flexion and extension of the wrist occur in the sagittal plane about a medial/lateral axis of rotation. True. True or false? The sartorius muscle produces internal hip rotation. False. True or false? Arthrokinematics of the hip joint are based on a convex femoral head moving within concave acetabulum of the pelvis. True. Which is a pivot joint? A. Sternoclavicular. B. Scapulothoracic. C. Humeral ulnar. D. Proximal radio-ulnar. The proximal radio-ulnar joint is a pivot joint. What ligament of the elbow is a cubitus valgus force is more likely to injure? MCL of elbow. What type of synovial joint is the first carpometacarpal joint classified as? Saddle joint. Flexion of the thumb occurs in the blank plane, and abduction of the thumb occurs in the blank plane. Flexion of the thumb occurs in the frontal plane, and abduction of the thumb occurs in the sagittal plane. As a convex surface moves on the concave surface, the roll and slide occur in opposite directions. The primary function of blank are to connect bone to bone and maintain the structure of a joint by resisting internal and external forces. The primary function of ligaments are to connect bone to bone and maintain the structure of a joint by resisting internal and external forces. The distal insertion of the biceps brachii is the radial tuberosity. What exercises would help strengthen the subscapularis? Internal rotation. The axis of rotation is always blank to the plane of movement. The axis of rotation is always perpendicular to the plane of movement. What muscles of the arm are multi-articulate? Long head of the triceps brachii and long head of the biceps. What bony landmark of the scapula is the insertion of the rhomboids musculature? Medial border. The intrinsic muscles of the hand that perform flexion of the metacarpophalangeal joints and extension of the proximal and distal joints of the fingers are called lumbricals. What joint do all four rotator cuff muscles stabilize? Glenohumeral joint. The head of the humerus is considered a blank surface that articulates with the blank surface of the glenoid fossa. The head of the humerus is considered a convex surface that articulates with the concave surface of the glenoid fossa. This joint articulation contains a fluid-filled cavity between two or more bones. Diarthrosis. What is a good strengthening exercise for the infraspinatus? Scapulothoracic upward rotation. The sagittal plane divides the body into blank and blank halves. The sagittal plane divides the body into right and left halves. What follows the second and third rows of the hand and provides longitude stability to the hand? Longitudinal arch. What muscles are agonists for GH joint flexion? Posterior deltoid, latissimus dorsi, teres major, and triceps. What plane does inversion/eversion occur? Frontal. External rotation of the shoulder occurs in the blank plane with a blank axis of rotation. External rotation of the shoulder occurs in the horizontal plane with a vertical axis of rotation. What type of motions describe the position of bone in relation to one of the three cardinal planes and axes of rotation? Arthrokinematics. What muscles are inserted at the pes anserinus? Gracilis, sartorius, and semitendinosus. What muscle is used in scapular protraction and upward rotation? Serrates anterior. What is used in kinesiology to represent magnitude and direction of force? Vectors. What muscle moves the GH joint into internal rotation, flexion, and horizontal adduction? Anterior deltoid. The bones that represent upper and lower extremities are part of the blank skeleton. The bones that represent upper and lower extremities are part of the appendicular skeleton. The muscles that perform the force couple of upward rotation at the scapula are the upper trapezius, serrates anterior, and lower trapezius. Abduction and adduction of the fingers occurs in the blank plane. Abduction and adduction of the fingers occurs in the frontal plane. What transmits compressive forces from the wrist to the elbow? Interosseous membrane. A muscle that fixes or holds a body segment relatively stationary so that another muscle can perform more effectively is a stabilizer. What muscles are used for neck extension? Looking up. The axis of rotation for the wrist occurs through the blank carpal bone. The axis of rotation for the wrist occurs through the capitate carpal bone. What muscles perform IP flexion of the thumb? Flexor pollicis longus. What muscles produce flexion and ulnar deviation of the wrist? Flexor carpi ulnaris. Movement of the distal segment of bone about a relatively fixed proximal segment is often referred to as a slash and blank change movement. Movement of the distal segment of bone about a relatively fixed proximal segment is often referred to as an open change movement. Which muscle is used for plantar flexion and knee extension? Gastrocnemius. Which movement of the palmar surface of the thumb is in the frontal plane across and parallel with the palm? Flexion. What is the movement that returns thumb to the plane of hand after movement in the sagittal plane? Adduction. Which movement of the thumb is across palm, making direct contact with the tips of any finger? Opposition. What movement returns thumb back to normal position after movement in the frontal plane? Extension. What is the forward movement of the thumb away from the palm in the sagittal plane? Abduction. The arthrokinematics of the radiocarpal and metacarpal joints occurring during all wrist motions follow the convex-concave rule that states roll and slide occur in blank directions. The arthrokinematics of the radiocarpal and metacarpal joints occurring during all wrist motions follow the convex-concave rule that states roll and slide occur in opposite directions. Which muscle flexes the MCP and DIP? Flexor digitorum profundus. When describing hand surfaces, dorsal is synonymous with posterior. What is the largest carpal bone? Capitate. How many phalanges are in the hand? (14). What muscle originates off the lateral epicondyle of the humerus and attaches the dorsal aspect of the second metacarpal? Extensor carpi radialis longus. What muscle flexes the MCP joint of finger 2 through 5? Flexor digitorum superficialis. What muscle neutralizes the radial deviation action of the extensor carpi radialis longus and brevis to create pure extension of the wrist? Extensor carpi ulnaris. What muscles extend the dip of the second digit? Extensor digitorum and extensor indices. What muscles are antagonists for wrist flexion and extension but agonists for wrist radial deviation? Flexor carpi radialis and extensor carpi radialis longus. Where do the common flexor tendons of the elbow originate? Medial epicondyle. Where do the common extensor tendons of the elbow originate? Lateral epicondyle. What is the distal attachment for the TFL? Iliotibial band. Which muscles act as a force couple to produce an exaggerated anterior pelvic tilt and hyperlordosis of the lumbar spine? Iliopsoas and erector spine. The fibrocartilage ring-like structure that deepens the connectivity of the acetabulum is the labrum. What muscle has a proximal attachment on the ischial tuberosity and a distal attachment on the adductor tubercle of the distal femur? Adductor magnus extensor head. What is known as the sitting bone, and is also the specific bony landmark for the hamstrings? Ischial tuberosity. The torsion angle between the femoral neck and shaft of 15 degrees is referred to as normal anteversion. Primary abductors of the hips are the TFL, gluteus medius, and gluteus minimus. The sartorius, gluteus maximus, and piriformis perform. External hip rotation. A person bending forward at the waist and trunk to pick up a box from the ground is best described as long arc pelvic on femoral movement into flexion. What muscle has a proximal attachment of the AIAS, a distal attachment at the tibial tuberosity and performs hip flexion? Rectus femoris. Posterior pelvic tilt involves a force couple that is produced by hip extensors and abdominals. The palpation of this landmark on the lateral side of the femur is easily felt during internal and external rotation of the hip. Greater trochanter. What powerful hip extensor has a proximal attachment along the posterior ilium, sacrum, coccyx, and sacrotuberous and sacroiliac ligaments? Gluteus maximus. Which ligament limits valgus, less than 165 degrees, of the knee? MCL. How do you maximally elongate the hamstrings? Anterior pelvic tilt, hip flexion, and knee extension. What knee ligaments limit sagittal plane motion? The The cruciate ligaments, ACL, PCL. Which muscles produce knee extension only? Vastus lateralis, vastus intermedius, and vastus medialis. What is the function of the PCL? Limits posterior translation of tibia on femur, limits extreme knee flexion, taught extension rotary motions of knee. Which ligament limits varus, more than 180 degrees, of the knee? LCL. Patella moves, blank, when extending the knee and blank, when the knees flex. Patella moves superiorly when extending the knee and inferiorly when the knees flex. If the vastus lateralis works with the vastus intermedialis, what movement is produced? Knee extension. What are the ligaments of the terrible triad? MCL, ACL, and medial meniscus. What is another name for hyperextension of the knee? Genu recurvatum. What muscle helps unlock the knee from an extended position? Popliteus. What is the function of the gracilis? Adduction, knee flexion, hip medial rotation, and knee medial rotation. What joint can deep squats damage? Patellofemoral joint. What helps with force production in the quads? Patellar tendon. Where do all four muscles of the quads insert? Patellar tendon at the tibial tuberosity. True or false? The internal rotator muscles of the knee far outweigh the strength of the exterior rotator muscles of the knee. True. Muscles in the thigh that are multi-articulate include rectus femoris, sartorius, gastrocnemius, semitendinosus, semimembranosus, and biceps femoris long head. What is the function of the ACL? Limits anterior translation of tibia on femur. What muscles pair for both hip extension and knee flexion? Semimembranosus and semitendinosus. A patient who is recovering from rotator cuff repair surgery has just moved on to the second phase of the protocol, and the physical therapist has instructed you to begin isometric strengthening with the patient. You should instruct the patient by having the patient perform active range of motion of the shoulder. B. Giving the patient a 2 pounds dumbbell to perform bicep curls. C. Performing passive range of motion on the shoulder. D. Having the patient generate an active force while maintaining a constant length of the muscle. The answer is D. Having the patient generate an active force while maintaining a constant length of the muscle. A muscle contracts by pulling the distal and proximal attachments closer together is best defined as a blank contraction. A concentric. B. eccentric. C. Isometric. The answer is a concentric. The muscles that perform the force couple of upward rotation of the scapula are the upper trapezius, serrates anterior, and the A. rhomboids. B. teres major. C. Lower trapezius. The answer is C. Lower trapezius. Which rotator muscle does not attach at the greater tubercle? Subscapularis. It attaches to the lesser tubercle. The short head of the biceps attaches at the coronoid process. Blank is an elbow flexor only. The brachialis is an elbow flexor only. Scapular winging or difficulty protracting is a weakness of the serrates anterior. What is the origin and insertion of the flexor carpi radialis? Origin is the medial epicondyle of the humerus and insertion is the second metacarpal bone. What are the primary movements of the subtalar joint, talus and calcaneus? Inversion and eversion. What peroneal muscle assists with dorsiflexion? Peroneus tertius. Its origin is the distal 1/3 of the fibula and inserts on the dorsal surface of the fifth metacarpal. What term is synonymous with peroneal? Fibularis. What muscles produce inversion? Tibialis anterior, tibialis posterior, flexor digitorum longus, flexor hallucis longus, and medial heel of gastrocnemius. What muscles cross the knee and ankle and produce plantar flexion and knee flexion? Gastrocnemius. What would the motion of the anterior tibia and the dorsal aspect of the foot getting closer be described as? Dorsiflexion. If you combine eversion, abduction, and dorsiflexion, what movement would you have? Pronation. True or false? The talus is located in the middle foot. False. The talus is located in the rear foot. Which nerve supplies the posterior musculature of the ankle and foot? Tibial nerve. What muscle is located on the distal 2/3 of the fibula and fifth metatarsal, and performs plantar flexion and eversion? Peroneus fibularis brevis. Which plane does abduction and adduction of the foot occur in? Frontal plane. What does the term pes planus mean? Flat feet. True or false? No muscles are needed to support the medial arch. True. The shape of the talus is concave or convex. Convex. What are the primary movements of the talocrural joint? Plantar flexion and dorsiflexion. True or false? Strengthening the fibularis muscles helps reduce inversion sprains. True. True or false? The soleus can assist with knee extension through reverse action. True. The foot needs to be planted. What is the joint formed by the cuboid and cuneiform meeting at the metatarsal bases? Tarsometatarsal. What are the intrinsic muscles of the foot that perform extension of the IP joints and flexes the MTP? Lumbricals. Is the shape at the bottom of the tibia and fibula concave or convex? Concave. Plantar flexion and dorsiflexion of the foot means the roll glide mechanics are same or opposite? Opposite. What are the three cuboids? Navicular, cuneiform, and talus. If you combine inversion, adduction, and plantar flexion, what movement would you have? Supination.